Good afternoon, everyone, and welcome to this Health Villages Data-Driven Services webinar. My name is Minna Eloranta, and I'm working in Helsinki University Hospital's IT management as a project manager. And today I'm going to tell you about the Health Village concept and services really briefly. Then we also have Pekka Kahri from HUS administration, and he is going to tell you about the data-driven services and Health Village. But before going to the actual topics, I would like to say one practicality. So if you have any questions or comments, you can leave those to a question panel, and we will go those through at the very end after Pekka Kahri's presentation. Okay, but let's start with the first topic. So with the introduction to Health Village. So Health Village is a digital service platform, and it has been developed in multidisciplinary teams. Overall, 3 types of services are delivered on top of Health Village's IT platform, and these includes services for general public, digital care pathways for a patient with a specific diagnosis, and then also digital tools and services for healthcare professionals. Even though we discuss about the digital platform and digital services, Health Village is actually much more than just a regular IT solution. One of the key things is that Health Village is actually supporting an operational change in healthcare sector. So every service in Health Village is designed in a way that those support the traditional care. And we also have this e-health development program that leads through the development process and thereby supporting this operational change. If we take a look at the services a bit more detailed level, so as I mentioned, we have these 3 visible services for the end users. So starting from the services for the general public, so these are accessible for anyone, and we have these so-called hubs that provides information and support for different type of healthcare challenges. The information is written by avoiding the medical terminology, so it's really easy to understand. And really important thing that this information is reliable and up to date. Overall, we have over 30 hubs, and some examples, we have a mental hub, a brain hub, a rehabilitation hub, and so on. Then we have the services for patient, so-called digital care pathways, and compared to the services that are available for general public, the digital care pathways are available for a patient with a specific diagnosis, for a patient with a specific diagnosis that has a referral or a care relationship. There is overall 3 types of digital care pathways. So there is digital care pathways that prepare for an operation, digital care pathways for chronic diseases, and then also digital care pathways such as web coaching and web therapy. Then I would like to mention that these are like communication channels between a patient and healthcare professionals, and overall it provides like instruction for different care phases, also self-care programs and rehabilitation programs. To mention some examples, so there is, for example, digital care pathway for diabetes, various digital care pathways for children, and digital care pathways for home dialysis. So the number of digital care pathways has already expanded to over 100. Then there's also services for professionals. And for professionals, we have this own portal, and the portal provides various tools and services. To mention some examples, so there's, for example, diagnostic tools, also online training courses, and one of the key things these services support in this digital transformation. So these are the visible services, but actually Health Village concept is much more, and there's things that enables the development of these services. So the basis of the development is a service architecture. Then we have this Health Village's IT platform that delivers and are built on top of that it delivers all of these three services, and all of these three services are built on top of this platform. The platform is cloud-based that technically enables the scalability of the services. Then we have this so-called Health Village eHealth Development Program, which is one of the core things in the concept, because this program provides the way to develop successfully the eHealth services. It provides tools and templates, process that are validated and tested for each development phase, covering ideation, planning, testing, implementation, and even the scaling for the large scale. To mention some examples from this program, so there is, for example, digital guidebooks, digital toolbox for development, and then also different type of coaching services and workshops. Then there's also tools for research, for example, for the consent management, and researchers have their own interface. And about the data, so data from the Health Village is going to Helsinki University Hospital's data lake, and from there it can be used for research and for improving the quality of care. Finally, I want to mention the supporting tools for creating and publishing content. And one of the key things in here is that these tools are really easy to use. So for example, we at the HUS IT management do not need to do the creation and publishing, but clinics by themselves can do it. So here is the overall picture to the Health Village services and Health Village concept. Then I would like to go through the key value drivers of Health Village. So first, engagement. As I mentioned, the services are developed in multidisciplinary teams. So patient, healthcare professionals, patient organizations, and IT specialists are participating in development. But I want to emphasize that healthcare professionals have really crucial role in development, and they are actually developing those kind of services that they are willing to have. Also important thing that patients are participating in development. Then the second key issue, so all the services are designed in a way that patients are at the center of care, and also the services are designed so that they're available 24/7, anywhere, anytime. Then about the scalability, so maybe a bit different aspect, that these services are not patient group specific, so those are scalable for any patient group. As I mentioned, we already have over 100 digital care pathways, and those are for different patient groups, and also those are scalable in any organizations. Then about quality and safety. So all of the services are evidence-based, so they're based on the latest research and best practices. And also we have this quality certificate, so we can produce medical devices. And the fifth one is the efficiency. So as I mentioned, we have this Health Villages IT platform and solutions, and also eHealth development program provides the standardized processes for different phases of the development. And this makes the implementation and planning of these services really efficient. And also the services had recognized to be really cost efficient. So for example, the services can decrease the number of revisits, decrease the number of letters, and also decrease the number of phone calls. So here's an overall picture to the Health Village concept and services, and also our key value drivers of Health Village. And next, we will go a bit more detailed level to the Health Village services, and Pekka Kahri will tell you about the Health Village and data-driven services. Thank you from my side.
Okay, good afternoon, everybody. So my name is Pekka. I work at Helsinki University Hospital in the development unit at the hospital administration, and I'll be talking about how the services are developed continuously based on the data that is collected from the use of these services. There will be some topics that are repeated from what Minna talked about. I start with the challenges related to digitalization of healthcare services. We have struggled in Finland, and I think that also in other countries. How do you digitalize services in a constant pressure of increasing costs, and being able to do successfully pilots or proof of concepts, but scaling up proves to be difficult time after time. And also how to scale across different medical disciplines and patient groups in an efficient way. And the concept of Health Village and the tools and the IT infrastructure makes this possible. So if looking, for example, the digital care pathways, how they are built, so there are basic building blocks that are available for the different patient groups and different clinical domains. So the IT part is important and enabling, but many of the tools provided by the Health Village concept are in fact ways to transform the clinic's way of operation. So not only bringing in new IT and web services, but also modifying how the clinic works when the patient is then physically present for an appointment or for a procedure in the hospital. And then there are standardized views and tools to build the views for patients to be used, but also for professionals, research, and those who are running the hospital and planning and reporting the performance. So these tools are in place, and as said, so at HUS we have already been building over 100 of these clinical paths, but once they are published and online and start to be used, then there is a continuous development of these services, which requires a process and capabilities of its own. If we look about how data-driven service development in a continuous way happens, of course it needs that the services, the digital applications and care paths are there. But then you need the users. The patients have to start using them, the professionals have to start using them and interact by using these digital tools. And then you need the developers and analysts who are able to draw data from the use of these applications and services, develop insight out of the data, that what has to be improved, what are the potential problems and issues to be solved, and then transform them into actionable features that can be then deployed as new modules or new improvements in the digital platforms. And data is collected a lot, but often this part that how do you make sense of it and then develop solutions that are deployable in production is a topic of its own. So if looking at the digital care pathways, so there are certain modules that are built and used for different patient groups. And then when the patients start using them, they have their own user interface where they enter and they can have the features, the modules like messaging, calendar, diary, consents, or surveys, entering own measurement results, etc., that are built with more or less standardized user interface tools. But still, these user interface can be customized to the specific patient groups, because the patient groups are of course different depending on what kind of needs they have. Then in order to develop and monitor how do the patients use this, then you need a reporting system. So this is in fact a live screen dump that I took yesterday, unfortunately in Finnish, from our BI solution, showing that how many customers, how many patients are present in different kinds of care paths over a period of time, meaning that we can have an continuous reporting of how patients are using the digital care pathways, which of course is a prerequisite in understanding that where can we start drawing data and develop new services, because if there is no use, or if the use is very small numbers, maybe there is not yet grounds for making further development. Then if looking at the professional side, so there is the Health Village Pro services, which also have their standardized modules where the professionals are then using, and similarly they have then view either to their patient lists in the care path or to the professional content that is used in the Health Village Pro services, which are then giving the view of an individual patient to the use of the professional with measurements, diary entries, etc. And then again, when you look at how to develop the services based on data, you need then a reporting view, again a screen dump from the Health Village Pro reporting system, showing how the different professionals are using this Terveyskylä Pro or Health Village Pro services, from which cities do they come from, and what kind of use patterns there are on these services. Again, giving data about how the professional use of these services is done, and then makes it possible to evaluate and see where new developments are required, and reporting of course outside how much these services are used. Then coming back to this slide, which Minna already showed, the key value drivers of Health Village. So these are the perspectives that are on a hospital level important. So they should be present in all clinical domains or patient groups. And somehow the hospital management and reporting has to also answer how are we meeting these goals. Again, there is a performance reporting view for Health Village where these topics, for instance, the percentage of all patients that are using digital care paths, giving goals and then following the progress from an online reporting system, or the amount of sessions, how many new mobile or other applications have been included. So providing a reporting view to the management and development activities, that how we are meeting the performance and the goals set by the hospital. Again, allowing for data-driven development of the services and the digital part as well. So when the development needs can be identified, so then of course there is the development work to be done, and how they are deployed into the services as new features or new applications. So again, just highlighting that there are these three channels or three main services: professionals, for patients, and for general public. And the requirements and processes how to include and deploy new services into these parts require slightly different type of expertise. But the main message here being that developing based on the data and new needs, the outcome should be new services that are put in production. So it's not only about research reports or publications, but it's about process changes. It's about expertise that is developed within the clinics, and then also increasingly helping the professionals to anticipate and do predictive medicine in order to meet better the needs from their patient populations. Looking a little bit under the hood, the technical side of it. So there is the platform which is running the services, includes IT and then application layers with different kind of treatment pathways, and the use of these services by professionals and patients generates data that is then dumped into a data repository or data lake, which also collects data from other hospital systems like the medical records, imaging and laboratory, and clinical quality registries. This data lake then can be mined and analyzed in order to gain insight about how the services are being used and what should be developed. And a key feature and key thing here is that it's done based on a scientifically sound methodology, so that research results can be trusted and then used as a basis for developing new services. Services that are then displayed here on these purple boxes mean that if, for example, a new predictive algorithm or a service that is needed in a patient groups, so it can be developed and deployed as a generic service, which then can be implemented either as a module in the digital treatment pathway or as a standalone application, maybe through other types of distribution channels. But the idea being that the service development and then the application and user interface development are not coupled together in a way that they would be offering just one solution. This part requires specific competencies, so we follow a quality system that is based on ISO 13483A5 standard, and if the services are classified as medical devices, so we can label them with CE mark and be sure that they are safe and useful to be used in a clinical setting. And these can be then repeated over and over again, and the important part is that the data is made available rapidly, and insights can be developed out of it, and then use the insights in developing new services that can be deployed and to be then used by patients and professionals. So the original first goal of the Health Village concept has been to digitalize healthcare services, where one of the goals is to move care also outside the hospital walls, so that the increasing needs of an aging population, lifestyle-related diseases, and other increasing service needs would not result in building more massive hospitals and ever increasing amount of healthcare professionals, but we can move that part of treatment into digital space that can be safely done, and in this way keep the costs and resources needed physically to run the hospital in a more controlled way. And this has been achieved by the scalable concept of the Health Village. Then continuous development is done with a data-driven approach, and we are currently entering that phase at Helsinki University Hospital. So the data is being collected on a data pond, and there is an product development processes in place that can enhance and introduce new models. The next step, hopefully in the near future, is to build and extend a Health Village ecosystem into a multi-party ecosystem where the use and development of applications and collection of data can be done in a broader context, combining many hospitals in Finland and also hopefully outside Finland. And we see that the ecosystem is the very ambitious and very exciting goal that we can build based on the Health Village IT components and the principles of developing continuously the services based on data and the use of these services. So this was in a nutshell my part about the data-driven services in Health Village. And let's see if we have any questions online. Please put them in the question panel. There's a question, could you provide more examples from the data-driven services? So at the moment, the digital care paths, so they have been built and developed, and they are now being run. Maybe the most amount of users is seen on the mental health therapies, and there, of course, how the services are being used is maybe more advanced. But as I said, so the principle of collecting data and developing new features based on that is now we are starting to do that at HUS with the amount of clinical parts that are there and have been built during the past 2 to 3 years. So more examples will follow. Do we have other questions? Can't see that. Okay, no more questions is shown by here. Okay. So there's a question, how far does the village go to prevention of diseases? So this is a very broad and generic question. Of course, there are the parts of the health village that are open for the general public, which is an important part. But then especially on the care paths of how you manage with the chronic condition is of course a very important part of preventing, at least preventing complications. And I think that this is an increasingly important part, that how do you provide the patients and general public more tools and more information in taking good care of their own health, and from a hospital's point of view, to provide information that is reliable for general public, and if and when patients come into a treatment because of some disease or event, they get also tools in recovering from this, and then if it's chronic illness, so manage their illness in a way that no complications are generated. Then there is a question about sharing the PowerPoint text. So this will be available on the Digital Health Village website with the recording and also the materials. It seems that there are no questions. Thank you very much for the attention. Thank you for joining us today. And stay tuned, there will be more webinars on Digital Health Village coming in the near future. Bye.